Hi, everyone. Thanks for joining. I'm just going to give it another minute or two before we get started to let some people come in from the waiting room. But I want to say thanks for joining our Let's Talk for May on ways to build your practice. Today's guest is Dr. Elizabeth Stanton. She's a licensed psychologist, and over the last 12 years, she's worked to promote accessible quality learning and student success in higher education. Currently, she has a private practice in San Diego that supports the needs of individuals, couples, and families. She also serves as an instructor, coach, and content developer here at Triad. Thanks, Dr. Stanton, for being here today, and we're excited to have you on.
Thank you. I'm excited to be here.
All right, I'm going to go ahead and give it over to you. And to everyone, just a note that this is recorded and will be shared with you via email later this week. And feel free to use the chat function if you have questions as the presentation goes along.
Awesome. Thank you. Well, we'll get right into it since we have a little bit short of an hour, and I want to get through the information that is really just more experientially based on my journey as I've started my private practice. But I want to leave room for questions and time for that. So I'm going to jump right on in and skip over this information about me. I want to just reiterate that we do have a place to continue this conversation. We definitely want to create an environment or a community, I should say, even better, of mental health professionals, no matter where you are in the journey, so that we can, not just keep this conversation going, but converse about other topics that are really relevant to what we're doing in the field today. So that link is also in the chat that you see here on the slide. And now getting into ways to build your practice. Now we're going to discuss a few different topics. Mostly, like I said, this is just based on my own experience as I began my private practice a couple years ago. And I thought that this topic would be relevant because as I began, of course, we learn a whole bunch of stuff when we're in internship and while we're, working with other professionals. But when it comes to some of the specifics of things that I don't know, we're just kind of left out of the description. So I thought about the things that I learned along the way, and then some of the advice that I've been given as well. And I guess these, again, would be the ways that you could really creatively grow your practice. As Kelsey noted, I'm in California, so my perspective definitely comes from that angle. But I did try to keep it as general as possible for those of you, of course, that are in different areas. Now, we're going to begin with the insurance dilemma, right? This whole idea is ways to build your practice. And when you're first getting started, of course, you're going to get advice from all different types of people. I had a variety. I had one mentor that said, don't do insurance at all. I had another mentor that said, oh, I've done only insurance. That's how I've, grown my practice and, made it to where I am. And then I had other mentors who, actually were like, look at it like this. Why don't you begin, the process with a few different insurance companies, start the credentialing and contracting process, because it does take some time. And in terms of which ones to pick, that would, of course, be determined, I would say, on the one that's the easiest to get credentialed with, but also one that it makes sense for the type of work that you do and where you are. So in that, again, processing time is important. Looking back, I want to say that it took almost like 6-7 months for some of the insurance companies that I contracted with to be able to go through the process. And so again, it's not something that happens right away, but definitely something that can start the process. And it doesn't mean that you're going to build your whole practice on insurance and insurance credentialing and contracts, but instead it kind of serves as like a buffer and a way for you to kind of maintain a flow of referrals and folks in terms of clients. And again, depending on where you are, certain insurance companies may not necessarily be one that you want to associate with. So I would, use the mentors in our life and people who maybe are working with insurance companies where you are, and just kind of talk to them about the process. Which ones are the easiest to do billing for? Who has the the easiest process when it comes to billing, I would say, is the biggest piece of it, of course, and then the credentialing time itself. Usually that's going to be long no matter what the company is. But in terms of the billing, one note would be like, do they have electronic billing already built into their service? So one insurance company that I ended up being credentialed with has a like seamless billing process. You go into their system, you log in, you don't fill out any forms, it's all electronic, it's all in there. So, there's no errors in terms of the person's address or any of that stuff. And when I compared that to the experience of some of the insurance companies that I work with, where it's a little more daunting, like I have to actually fill out a form, that CMS 1500 form, and then mail it to them or fax it to them or some other process. So it just varies. And again, considering that even before you credential or contract with an agency, to know what that process is like, and then being thoughtful of it's probably going to take some time to get started with them, but always good to kind of just get it going. And again, where you are, it may depend, but the advice that I was given to consider it just to get things started, I would say, was beneficial and helpful in terms of keeping the flow going over time. And then in terms of billing, like I mentioned, whatever that process is, but also being thoughtful when you do engage with folks when it comes to insurance. If you decide that you're not necessarily going to contract with any insurance company, there's still the way that you can market yourself or advertise that you do work with, like the patient or the client to bill their insurance company if you're willing to, perhaps give them an invoice and that type of thing, so that then they can be reimbursed for whatever their payment is. But if you go with a insurance company, being thoughtful of, the co-payment process and whatever the deductibles are. So that's something that was like a blind side that I didn't know. One insurance company in particular, the person had a deductible. And so I went to bill, but technically, because they hadn't met their deductible yet, they had to pay me directly. So little things, right? So, it wasn't a big deal. It was just an extra step. But had I known, it would have been nice if I knew that ahead of time or thought of that ahead of time. So when you do engage with insurance companies, thinking about the processing time that it'll take to get within that. And then, of course, once you're part of that program, the co-payment process, and then being thoughtful of deductibles. I also have a note here about the CAQH, and that's the Council for Affordable Quality Healthcare. And if you haven't already, that's it's essentially an agency that has put together a place for us to house all of our very important professional information. So things like your insurance, your malpractice insurance, your license, your W-9, perhaps things that would be essential for an insurance company to contract with you. Then they're able to access your CAQH files and automatically have access to all of that information, so that then you don't have to provide that and essentially prolong the process. And so that's something that, just kind of getting ahead of the game, you could engage with the CAQH website, create your account, and get that process going. Because again, all of it requires a verification of your files and all of that. So then that's ready. So when you do, if you do decide to go with credentialing with an insurance company, you already have a CAQH number to provide them with, and you're ready to go if you decide to go that route. But definitely something to maybe just do so that the information is all there. It doesn't hurt. And then if the time comes, you already have that available for them. Now, the other part about the insurance companies, or a branch of that, are the EAP programs, right? The employee assistance programs. And within the employee assistance programs, these do align many times with a specific insurance company, but there are some EAP programs that do offer employee assistance to individuals and through their own specific entity, not necessarily assigned. And the reason why EAP programs could be another avenue to generate some clientele and just build your practice in that sense is because these are a little bit easier in terms of billing. It's a set it's a set fee. There's no co-payments, and it's just a direct interaction with the program itself, whether it's the insurance company or one of these types of programs. And then it's, a little bit more of a seamless process, just a little bit, but it's another option. And these are, again, folks that have a limited number of sessions, but that does kind of help in some ways because you can really just get to the nitty gritty, right? Like we only have 6 sessions. So what's going on? Let's just get to it. And that can be helpful. And I've actually had some really positive experiences with EAP programs in terms of the short number of sessions, because sometimes folks do just have just an issue that they need some help with resolving, and we get through that and they're good to go. And I listed these 2 different entities, not because I'm endorsing them in any way, just in preparation for this. I thought it might be helpful as we're discussing EAP programs or employee assistance programs to give you some that aren't associated with any insurance program. So I imagine the credentialing process with both of these, LifeWorks and Talkspace, are going to be probably a little bit faster than the process with the traditional insurance company. However, all of them are worth looking at, right? So some of the insurance companies have an opportunity for you to serve as a provider for just their EAP programs. So when you're looking at them, notice if they differentiate your application for that. And then these 2 programs, like I said, are just 2 that, as I was looking up different EAP programs and options to kind of give you to think outside the box of just the traditional insurance company, these are 2 that came up that also aren't associated with any particular region. So I could tell. So just to give you, kind of a starting spot to look at some different options for EAP. And like I said, none of this, you're glued to. I mean, you're still your own entity, right? You're not an employee of any of these organizations. You would just simply be contracted with them to do work as you see fit, right? Like really as it fits into your schedule. So you're not obligated in any sense. Of course, the contracts will explain that, but it is a way just to have options of growing your your practice. There's a quick question here. With EAP programs, do we still have limited number of time for documentations? With certain programs, they'll ask you to submit forms within a certain amount of time, but it'll be very clear, when you're getting into that. And it's pretty reasonable. I've had one before that was a different type of company, like it wasn't necessarily an insurance specific company, it was just an EAP program. And they asked for you to submit like an intake interaction form within, I think it's like maybe the first week of the first session. And then I think that was really the only time frame that I remember. But again, I mean, we want to be, of course, good stewards of deadlines, etc. But it's usually pretty flexible. So, but something to look into and be aware of before you get engaged with, any organization, to know that you'll be able to meet whatever those requirements are. It's interesting with limitations with the insurance companies, because I didn't mention that, but when we talk about billing, I guess one other caveat of billing is that it does take some time. And I guess even with the EAP programs as well, if you submit an invoice for your work, it may take a little bit of time before you're actually paid. So you always want to be considerate of that as well. Some of the insurance companies are faster than others, and then some are a little backed up, which, makes sense. Many of us are, but thoughtful too, just in terms of, if you're banking on it, that it may take a little bit of time before they send it to you. And especially like if, forbid there's some error on the form or something that prolongs the process. But another caveat to think about when it comes to billing. Now, another avenue of growing your practice, in a sense, takes another route. And here we kind of turn the corner. And if you're into, especially if you're into any type of forensic work, right? If you see yourself working in the courts at all, or doing any kind of testifying or anything like that, this is definitely a step in that direction. But even if you are like, no, I don't want to do courts, I don't want to do any of that, this doesn't mean that you're tied to that either. So just because this is labeled county courts, it doesn't mean that you have to actively engage specifically with the court, right? You're not tied to testifying. However, it does give you an opportunity to work with another set of referrals, basically. And so many counties in the court system, they'll have resource lists that are provided to individuals for a variety of reasons, right? Some people are ordered for individual therapy, some people are ordered to do substance abuse assessment or even substance abuse treatment or education. Some people are ordered for parenting classes, clinical visitation monitoring is another one, and child custody evaluations as well. I'll talk about those two in a second. But with these other options, these are ones that you don't necessarily have to be into forensics or courts to do individual therapy, right? Or to do substance abuse assessments. Now, you might end up, depending on the situation, I guess you could, end up having to testify or having to write a report for the court. That could be even likely. But again, it doesn't mean that that's all that you're doing. And could even maybe be kind of fun if you're into it. But just other ways to become a resource to your community, but also to be able to grow your practice in other ways. Sometimes people refer to these lists just because they know that there's a list available. It doesn't always have to be something court ordered that's going to tie you, to something legal, but it does, again, offer you some other avenues. Now, when you think about clinical visitation monitoring, this is something that, again, I wasn't even privy to, but then once I learned about it, I was like, well, that's pretty interesting. As a licensed clinician, you may be able to provide clinical visitation monitoring for families that have been given supervised visitation per some court order as such. Now, this is definitely where there may be some more court interaction involved in terms of, a report, but it does offer another avenue that's totally different from therapy and some of the everyday work that we might do. And, if a person has been ordered supervised visitation with their children, and usually if it's something that, there's some level of maybe abuse in question or some allegations or even findings of that, or some other component that goes beyond just parents in a quarrel, right? Or parents that are disagreeing about custody, et cetera, but something that requires that there's a clinician involved in the supervision, which is again beyond someone who is just a visitation monitor, which those are great too, but you could kind of use your license in a sense to offer the clinical visitation monitoring. And then child custody evaluations is another avenue, working within the family court system, where training for this would be involved, and with the visitation monitoring as well. But with the child custody evaluations, there is a training that you can take that will provide you with an opportunity to do child custody evaluations that are ordered by the courts. And essentially, you would do an extended, very thorough, comprehensive evaluation of the family, the children, the parents, and even some, collateral contacts, reviewing documents, etc., so that you can give a recommendation on the custody component of whatever the case is. So, right, should the children be with their parents 50-50? Sometimes there's very specific questions like, where should the child, go to school? Where should the child spend the summers? How should they break it down? And it doesn't always get that particular, but sometimes, and you can give some recommendations based on your evaluation of the family and going through that child custody process. But again, a whole other avenue to consider ways to use your license and grow your practice. Because again, individual therapy is great, but sometimes we want to do a little bit beyond that, right? Or a little bit more, not beyond, but even more. Now, when we think about marketing, this is another place where we could take advantage of some different pieces to perhaps grow the practice a little bit more. I have business cards here, and that might seem like a given, but it is important, right? We might take this for granted. I know some folks who don't even have business cards because they say that nobody uses business cards anymore, et cetera. But I mean, it could be true, but it is something to consider and to think about how if you perhaps have business cards or some way to make contact with you, the information that you want to have included on that to make it the easiest, I should say, for someone to be in touch with you. I have this next piece about a statement of services, and not anything that's like official per se, but one thing that I did early on was I do have an interest in working with the family courts and doing, some of the child custody evaluation pieces, but even, like psychological evaluations or substance abuse assessments, all things that may be court or family law related. And so I actually did some research and took note of all of the different family law firms that I could identify that seemed like, they might align with some of the services that I offer. And I essentially just made a list of them. And then I created sort of like a mailer. And so I made a statement of my services, just, like introducing myself as a psychologist in the area, and that these were the services that I provide, and then even threw a couple of my business cards in the envelope. And I went old school and mailed them. Like, it was interesting, and it was definitely something that I didn't expect. But months and months, probably like a year after I did all these mailings, and trust me, a whole bunch of them came back too. It was painful, but I figured, hey, something might reach someone. And sure enough, about a year later, I got a call from an attorney who said that she received my statement of services, that she got my cards and stuff about a year ago, and she held on to them, and now she was in need of, I forget whatever it was, but and she wondered if I still, did that, and did I have availability, etc. And I remember just smiling because I was like, wow, that's so cool. My little mailers actually did something, and it wasn't something expensive, and it was kind of fun to really realize what I actually do. When I say this statement of services, it forced me to think about, like, what do I do? What kind of services do I offer? And what do I actually want to do? Like, what do I want to tell people I do? Because that's the kind of sort of business and clientele that I want to get. And so it was sort of fun to design that and send it out. It wasn't anything fancy. I didn't go to Kinko's or anywhere to print anything. I did it at home and just mailed it out. So that's one option. And again, I have the slant of being interested in some of the forensic pieces, but if you have a different slant, maybe you're working with children with challenges with learning, right? Maybe you want to consult with agencies that specialize in learning disabilities or something along those lines, just to make those connections. But think about it in terms of, the most creative way you can. Something like this also, when we think about marketing, I would say it's good to kind of just take a seat back, and maybe, have a sip of coffee and think about, one, what services do I offer? And based on those types of services, who should I contact? Like, who should I, let it be known that I'm this, little person in private practice here that no one knows. And I want to make sure that they know that I have this availability, and that I have, the competency for these services. And that might look different for different people depending on what your background is and what your interests are. But take time to kind of think about it. Like, who do I want to connect with? And then find, the internet tells us everything, and, put a few little feelers out and see what happens. Again, I mean, I don't know if any other people contacted me from those mailers, but certainly that one person did. And then Psychology Today. This is another piece that, depending on how you want to sort of market yourself online, if you don't have a website, or even if you do, oftentimes people go to a website, and I'm not advertising for them, but Psychology Today, in my own experience, has provided me with a few referrals that I was able to receive via email, or directly calling me. And I don't have a person, like a business website, so it's been helpful to kind of buffer between having my own website and not, because it has all that same information. And there's a lot of different ways that you could use something like this as well to sort of maximize all the different pieces of marketing. You can add a video, you can talk about your services, the populations that you work with, etc., and really provide a lot of information about yourself. And again, it's something that is likely to come up when someone searches your name, or be a place that someone will go to find services or find a clinician for various services. So that's just an option. And Psychology Today is one of many different types of advertising So I wouldn't necessarily go directly there, but you do get a free magazine, and you can see which works for your particular field. I know that at the beginning, someone said that they were in LCSW, and so I know we have some different mental health professionals joining us, and so I would say whatever makes sense for your field would be the most beneficial. And the way that you might determine that is just talking to some of your colleagues. Much of the directions that I went was, guided by some of the questions that I asked, but it wasn't necessarily just given to me, right? I had to ask some questions like, hey, what do you think about this? Did you use this when you started, etc. So psychoeducation is another part. So there's different opportunities for you to perhaps, if that's something that's in your realm of interest, is to teach people about things in our field. Maybe someone has an opportunity for you to discuss uh, the various developmental stages, right? Maybe there's a parenting organization or some organization that needs someone to talk about parenting or someone to talk about something that we know about, right? Well, take advantage of that, even if it's something you're not going to get paid for, because it could give you more opportunities to connect with other people. And then, of course, just, be an opportunity for you to um, give back, to our community, etc. And then oftentimes there are paid opportunities. And when it comes to those also, I just want to encourage you not to feel like you're not competent to do that, right? Because if you have made it to your license, etc., even if you're almost there, you can definitely teach some people some stuff, right? We know a lot of stuff. So be creative in that as well. And think about, if you hear someone saying that, they're having a conference or they're having um, some type of gathering where there are people and they're going to have speakers or something. And if you get the sort of the niche for it, I would say do it. I mean, you're the expert. Who's going to know better than you? And this is where being a student especially takes place, right? All those papers we had to write and all the presentations we had to do, right? Oh my goodness, just to think back. But really, it was like good because now you're ready, right? So if someone says, hey, we're doing this conference on, we'll go back to parenting, and we really want to address how COVID has had an impact on children and their, desires to go to school, right? Kids don't want to go to school anymore. I don't know, just throwing that out there. Well, then, yeah, you're going to do some research and present. Why not? And then you're going to show up, and then people will take your business card, right? 'Cause you're going to have some of those, or they'll be able to look you up online on your website or whatever that is, or both, because of the learning that took place in that experience. So I would say broaden your perspectives, and remember that as well when we're thinking about marketing. Not just how you're presenting to the public, but also when you think about all the things that you can do. And that kind of goes back to sort of sitting there thinking like, what services do I provide? What do I do? And another thing also that can be helpful is when you go to websites like Psychology Today or other ones that are similar, look at how other clinicians are presenting, right? What do they say about themselves? How do they describe the work that they do? And not because you're going to steal it, but I mean, which I guess you could, but so you can get an idea, right? It kind of helps. Like, oh wow, I didn't even think about that. Like, oh yeah, I can do that too. So broaden your perspective for sure when it comes to marketing as well, and believe that you can do a lot of different things. Now, of course, we're not ever going to say we're experts in things that we're really not, but you can certainly do some research and give some people some information for sure. Um, okay, so networking is another piece of this. When it comes to connecting with organizations, maybe for conferences and things like that, some of that can be done by joining associations. And there are so many different associations, right, for the various areas that we work in. And then also, for the cities that we're in, maybe some of the local chapters of the bigger associations. I would say, you don't have to join all of them, but maybe consider joining a couple of them, and maybe think about the different types of committees or the type of work that's done within the association. And if there's a way for you to connect with that somehow. There are, for instance, within the San Diego Psychological Association, they have various committees, aging committee, ethics, supervision, etc. And I even have been able to serve on the Addictive Disorders Committee And that in and of itself, just making associations with other clinicians that are kind of doing some of the same work that I've done, I've been able to just get referrals from like people that I would have never met if I was just in my own bubble. I would have never ever encountered these individuals who, because we were interacting on the same committee alone, it was like, hey, do you do these? Like, do you do these assessments? Do you do these evaluations, etc.? And it was like, yeah, I do. And then we just kind of made a connection that way. So again, a benefit to, making the associations that we get to do when we join the associations, right? Play on words, but it's true. And we want to use those networking opportunities for that. And again, that's another place where you want to show up and yeah, like, some stuff, and you have something to offer to these associations, or, to becoming a committee member, perhaps to some of these committees as well. So networking is big. And I know that for like the last couple of years, networking has been quite limited because of our pandemic situation and not really being able to connect in person, right? It's a little bit challenging, but our small committee meeting on Zoom still did afford me some connections. But I will say that when it comes to the larger opportunities for maybe presenting things like that, or even just being able to attend some of the different conferences, those are other avenues that we can take advantage of, so that we are perhaps making the connections that we wouldn't normally make, just again in our own bubbles. And so thinking also when it comes to networking about, I guess this is sort of back on the other side, marketing, but also thinking about, your writing, right? There are, even within the associations, some of the committees that I've been on, I've had members who, will send out these like sort of quarterly networking, or not networking, but like these quarterly informational updates, or something that has really to do with their practice, but they're sharing it with the committee, etc. And so those are other things to, think about, that when you make these connections, these are other people that you can sort of communicate what your services are. But then also when it comes to the writing piece of it and being creative, when we think about even the psychoeducation and speaking to people, there's also the opportunity for doing writing as well. If there's perhaps some type of maybe even the Psychology Today magazine, right? Or some other avenue that you can communicate some of your research interests, or some of just the information and knowledge that you have with the broader community. Those things not just sharpen you as a clinician, but then they also are ways to grow your practice, because more people learn that you're, a person, that you exist, that you have an office somewhere near their, in their community. And that's pretty cool. So I would say when it comes to the marketing and networking, kind of, blending those two together in a sense of really just taking the shot, right? And just seeing what happens. I mean, the worst thing is that it won't work, but that's okay. You try, and then you'll see. Now, if you have the opportunity to create a web page, I would also be thoughtful, of the other technical pieces of it, right? If you create a web page, we want to make sure that it's user friendly, that it's accessible, that that it's organized, that it makes sense, that it's a really good representation of you and of your work, because people will be paying attention to that. And so again, just kind of blending those things together and being really creative and taking the time to think, how can I sort of be a sort of an entrepreneurial mindset in this? And then I'll say lastly, and I don't have a slide for this, but it's okay. I want to make note of another way that grows your practice that does take some time and is really discussed in a whole nother presentation that we may be able to do at some point soon. But when you think about being able to be licensed in multiple places, not necessarily that you're going to move to other places, but being able to have access to other states, for instance, to be able to do maybe teletherapy and to grow your practice in that way, because you've associated with maybe an organization like Psy.D, and you're able to broaden your clientele and your patient base by having telehealth options that go beyond your state, because you are either licensed or somehow a part of, the compact to be able to do that work in another place. So that's kind of a whole nother conversation, but it is a way to be able to grow your practice. And so I would kind of lastly even think about that as we think about creative ways to grow your practice. The other last thing, well, not last, but still on networking. So there's the sort of the dilemma of, do you go on your own or do you join with another person, or how does that work? And I would say it just kind of depends on your desire and what opportunities you have to be able to either join someone to work together and kind of in a clinic kind of setting, or to not in a clinic setting, but in a group private practice setting, or to be in a solo practice. It really is just going to depend on what you want to do and what you're interested in. But I would say don't be afraid to go out on your own. Nothing's wrong with that. Other than not having people to talk to, it's not that bad. And sometimes though, it could be, I see folks who function in like the group setting, and even in like my internship times, and observing that there is a lot of networking that takes place, and some referrals and that get shared amongst the group, which can be really helpful. And it can also be nice to have folks to sort of consult with on different cases. But again, we always can pick up the phone and call people that we know too. So those are just some different things to consider. And I would say on that note, we still have some time for questions. Are there any questions at this moment?
I have a question. Am I coming in?
Yes, we can hear you. Thank you.
Oh, fantastic. Yes, my name is Biani. I'm a licensed mental health counselor, and I was thinking about liability insurance, and what your thoughts are on that, please.
Yes, no, great question. So liability insurance is something that you definitely want to make sure that you consider and have. There's different companies that you can go with, and I would say just comparing their rates, but you want to. I've seen that pretty much the minimum is the 1 million to 3 million range. There's like different levels. And I would say that is the minimum to get, because when you're contracting with various insurance agencies, usually that's the minimum that they'll require for you to have as well. And it's not like a break the bank kind of thing. When you hear 1 million and 3 million, you think like, oh my gosh, what kind of payment is that going to be? But I've seen them, that range from $500 to like $700, just depending on the insurance itself. And I would also say that there may be like legal services that are offered from the insurance as well. And I would consider that when you're going through and if you're comparing different insurance agencies, I would see what they offer. Like, what are you actually paying for? Do you get consultation outside of, an actual case or something like that? And are you able to call perhaps an attorney if you have a legal question or some dilemma that you need some help with? And definitely consider that. Okay, there's some questions in the chat too. Does that answer your question? I think so. I think we covered.
It did. Fantastic. Yes, I took notes.
Okay,
Thank you.
There you go. No problem.
Yes.
All right. And then so there's a question here about how do we get on insurance panels? So the insurance panel piece, I would say start with the CAQH. Literally, just if you look up CAQH and start the process of an account with them, so that all of your information is there. And I mean like a copy of your license, a copy of your liability insurance, etc. And then when you go to various insurance companies, and again, I would just kind of get some advice from people who have worked with some of the insurance companies to tell you yes or no. I definitely got helpful feedback of like who not to go with, just based on where I am in California, like no, because they're gonna do that, whatever. So that was helpful. And then you literally just go to those insurance companies' websites, and it's kind of tricky sometimes, but just look for wherever they talk about providers, because you are a provider. And when you usually when you click on providers, it's going to give an option for those who like are a part of it, right? But they can log in. And then somewhere in there it should say something about joining their network. And then that's how you want to start the process. and go through whatever that is of joining the network, which is probably going to be at the very least giving your contact information and your CAQH number. I've noticed that that's always requested because, again, that's how they connect to your information automatically without having to go through you giving it to them, et cetera, et cetera. And then it's the CAQH, they actually like verify your information. So I think that helps to speed up the process. You'd think it'd be faster, but it's not. Anyway, okay, do you have any resources written or otherwise you would suggest? I don't have any written resources per se about this process, but what I would say is to, like, depending on what your interest is, right, to maybe ahead of time see how that works in your area, right? So if people aren't necessarily, like, if you live in a town that doesn't have a big court system, you actually might get lucky and be like the only person who does court ordered assessments. Or maybe you live in a town where that's not really likely, then you might go a different route. But I don't have anything specific, but definitely, just getting creative and looking up stuff online. I mean, of course, not all of it is legit, but we know what to cipher through. Then there's a question here about, do you recommend, oh, where did it go? I work with 3 group practices as a contract therapist with a 1099. How is it different with a private practice besides the money? I guess it's not necessarily different, except, well, it's not different if, I mean, those are just, they're private practices, right? But they're just within groups. So you're within those 3 different groups. I don't think that that's much different, except when you go into your own solo private practice, technically, you are like giving yourself your own 1099. I mean, that's the very like generic way to explain it. So it would be a difference, like you said, in the money, but then it would also, the shift if you go into solo private practice, like your own business, is that you are gonna have to report your earnings still, right? But just like in a different way. But it would be basically a 1099, but you would just be reporting the 1099. And then depending on if you contract with insurance companies, they'll also give you the tax information at the end of the year for you to include for your income. And then let me see here. Do you recommend starting private practice in your home, since we can do telehealth to avoid overhead costs? So I think it depends on where you live, and it depends on if you only want to do telehealth. So if you start in your own private practice, if you're like, I know this is all I want to do right now, and I'm only going to do telehealth, then it's not necessarily a bad thing, but you just want to be thoughtful of how that information shows up publicly, because then that's sort of like your office. And so, maybe like the use of a PO box, of course, or something like that. It just would kind of depend. And then it may also depend on actually, no, yeah. And I guess I was going to say, if you are contracted with any insurance companies or anything like that, but if you're only doing telehealth, then I don't think it would matter. But I would also say, if you're starting your private practice and you only want to do telehealth, I would, right, if I could look at you, Ingrid, and ask, I would say, are you limiting yourself? Like, are you only doing telehealth for, if it's because of some other reason, yes, do it. But if it's, I would say, are there plans to grow beyond this, because you have so much more to offer? Okay. How long on average does it take to grow to a full-time caseload? I don't know what the average is, but I know that there came a time when I realized, and it was, I would say, like within about the first 9 months, I would say around the first 9 months of my first year of my own private practice, I had maybe like 22 regular patients. And I remember thinking, oh, this isn't gonna work. Like, this is it. Like, when I, started looking at the numbers and averaging and whatever, And I was like, I'm gonna just have to go get a job. Like, this doesn't work for me. And then all of a sudden, which I realized in hindsight, all of a sudden I started getting all these referrals and these calls, etc. And it was had a lot to do with the insurance company referrals. Some of the timing was sort of, like crisis related. However, it was also, I think, because of the credentialing process. So when I first started, I started credentialing with some of the different insurance companies. And again, that process can take anywhere from 6 to even 9 months. I mean, especially if you go into a pandemic, right? So everything gets a little prolonged. And I think once those processes were finally complete, then things started growing a lot faster. So all that to say, I don't think it takes a long time if you have, if you're contracted with a couple insurance companies, because they're going to come pretty, regularly, depending on your area as well. So I guess to answer the question, I don't know, it could take anywhere from 6 months maybe to a year, depending on all those different components and how people are finding out about you and what you're doing. How long does it take for insurance companies to pay invoices for mental health professionals? Just an approximate time frame. Thanks. Well, Maria, let me tell you this. So some insurance companies have been able to, I would say maybe if I've submitted billing electronically, right? A company that does the whole electronic piece, say I submit the bill, I might have payment in like 2 weeks, maybe 3 at the most. So that's like awesome, right? But then I've also had some where I literally got a check with the statement on it, and I like looked at it and it was like, what? It was like from November, no joke. So it just depends. It just I don't know what happened. I have no idea, but sometimes it just depends on the insurance company. But I would say that the latter is definitely an extreme, for it to take that long. And I think the likelihood of it turning around faster has a lot to do with the accuracy of the bill. So again, when I was saying the electronic ones are helpful because you can't really have too many errors on those because they're already populated and all that. But it can take, so I would say anywhere from 2 weeks to 2 to 3 months, just depending on the company and the bill itself. Any advice on non-compete documents? I don't know, Sonia, when you said non-compete documents, I don't think I know what you mean. So tell me again, let's see. Is insurance also required when doing consultation type work? You always want to have malpractice insurance because you can always be sued. So I would just think about that. Like anytime you're interacting with the public, you never know what's going to happen. So even if you're not working or contracting with an insurance company, or like, again, if you're just doing consultation work and maybe working with a company, I would, if you're not covered by the entity that you're consulting with, I would consider it, and that's another place where if you are part of an association, sometimes like with the APA or even some of the local associations, they do give you access to attorneys that can give you advice like that, right? Depending on the type of work that you're doing, how much should you get insurance? What should you do? And on the note of insurance as well, I was also given the advice to consider paying a little, there's like a small amount extra that companies might charge you for the administrative pieces of the cases. So like say someone attempts to, like if they bring a case against you or something like that, and then there's the million and the 3 million that cover things like in terms of all the proceedings, etc. But I guess there's other fees that are more administrative. So again, things to think about and questions to ask when you're getting these different types of policies to make sure that that stuff is covered, because you want to be able to ask those questions and have that coverage if it's necessary. How costly is it to start an LLC? I don't know specifically, Ingrid, about starting an LLC. I know that it can, depending on your state, it can be costly. The advice that I was given was to take a look at my my annual income and tax information, etc., and then like do a comparison between that and then if I switch to an LLC or some other type of entity to determine if there would be a big shift in the amount of taxes that you pay, because that's one of the big things that you want to consider when you start making those choices. I am pre-licensed working as a psychological assistant. It's irrelevant in my case to join the C. I wouldn't say, Nadia, I wouldn't say that it's necessary to join the CAQH just yet, but as soon as you are licensed, because you need a license number to put in there. So as soon as you are licensed, though, that's like, you want to do that ASAP. And do you have any suggestions for companies who make websites for therapists? I don't actually. I think that's, to be honest, part of my dilemmas, because I don't exactly know who's the best at it. I had some referrals, but they didn't exactly work out. So I don't know. I think that would definitely be more of a referral basis, though. Like if you know some folks who have some pretty awesome websites for their business, ask them who does it, and then just because if you see their work, that would probably be the best way to go. I know there are some organizations that offer website services to clinicians. I would say whatever it is, take a look at it first and see, does that work for you, right? And does the fee for it make sense for what they're really going to offer? What company do you recommend for charting? So honestly, I don't have a company for billing. I just do it all myself, which sometimes doesn't always feel like that was the best choice. But I mean, it can sometimes get up there in terms of the number of people that you're billing for. But I've done it myself, and so far, I haven't used a company yet. But again, I would say whatever you do, make sure you get some recommendations to make sure that it's really legit and that they do a good job. Let's see here. Is there administrative documentation you'll need to start your practice, such as a form from the mayor's office? You might need to register your business with your city. Like you have to sometimes, and I imagine in most cities, you have to pay a business tax to the city. And so that's like a way to establish like your business license, because you may need that for other entities that, just want to see that you actually have a business. I already said, I don't know about the billing. I have never been audited, so I don't know anything about that. And maybe one day I might have to come back and do another one and say, this is what you do if you are ever audited. We'll see. Some agencies, several that you're contracting as to, okay, I think I understand, Sonia. Some agencies, several that you are contracting as to sign a non-compete. Oh, like you would not service any other clients in the areas. No, they don't do that. There's no, I got you. I'm sorry, I didn't understand the first time when you put that. There's no non-compete kind of thing. At least not, I haven't had to do anything like that with any of the insurance companies that I work with. Yes, I believe you'll get access to the recording. Oh, there's the answer there. A limited liability corporation, I believe, is the LLC. And all of those things, like that are gonna affect, like somehow affect your taxes. Make sure you talk to a professional, like a CPA or an EA or someone who really knows taxes and that kind of information. I wouldn't exactly talk to another clinician. I would go talk to a professional in the field on that one. Let's see. The private, the secure platform, recommending a secure private practice electronic platform that's HIPAA compliant, that does scheduling, emails, etc. That's not too costly. Some charge upwards of several thousands a year. I don't know of any offhand, but I would also think about, like when you're first starting off, there are some costs that aren't necessary, right? And so if you could manage doing your own like scheduling, etc., in obviously a HIPAA compliant way, that would be great. I would do that first. Let's see here. And then when you say a resource to learn what our rates can be, so you can set your own rates, obviously, for your private practice. And I would do that with some consideration for essentially your colleagues, right? I was about to say your competition, but we're not competition for each other. We're just other people doing the same services. And so I would kind of get some information about what rates are in your area or for that particular service. And then the insurance companies tend to have rates that are set based on your license type. And let's see. Okay, Michelle said Brighter Vision specializes in websites for therapists. Thank you for that, Michelle. That's helpful. Oh, and Maria's contacted local businesses, so that is awesome. There's some other advice in the chat about some places that you can go that'll give you platforms. So thank you guys for that extra information. Any other questions? We are like right at the time. This has been great. While anyone is typing their last questions, I'm just going to share this other slide with you. As we mentioned, you know, continuing the conversation is important. We want to give you a space where you can do that as a community to talk more about this and to, I mean, we have stuff about telehealth and other pieces as well. So please take note of that. And if there are any other questions, of course, that's a place where we can communicate about that. And you can always find me as well. Headway will do all of the admin stuff too. Oh, that was another one. Thank you. All right. Well, on that note, you all, I think we're good to go. Kelsey, do we need to do anything else before we end for today?
Thanks everyone for joining. Thanks, Dr. Stanton, for a great presentation. Like you said, if you join this group on Triad, resources will be shared there. And if you're a member, we actually do have discounts available to Triad members for things that we were talking about, like building a website and, you know, those HIPAA compliant platforms. So go ahead and sign up for an account if you don't already have one, and join the group, and we can continue sharing those resources with everyone.
Yeah, perfect. Thank you. And
Awesome.
thank you all for being here. This was great today.
Yeah, thank you guys.
Yes, thank you.
Bye.